Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this session or lecture is Legal Considerations in Medical Scribing within the chapter of Review of Medical Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. As for definition, the legal considerations in medical scribing involve understanding the laws and regulations that govern the documentation of patient encounters and the handling of sensitive medical information. Legal considerations serve as the foundation for the practice of medical prescribing, ensuring that every detail documented in healthcare meets stringent compliance standards. Scribes are entrusted with managing sensitive patient information and creating accurate, timely, and compliant medical records because these records are used to guide treatment, billing, and even legal proceedings. Adhering to regulatory requirements is a critical responsibility. The core legal aspects of medical scribing aim to protect patient privacy, uphold the integrity of medical records, and minimize liability for healthcare providers. Key regulatory frameworks such as the Health Insurance Portability and Accountability Act (HIPAA) enforce strict guidelines for safeguarding patient information. Additionally, the rule of informed consent ensures patients are aware of and agree to the scribe's participation in their care. Scribes must understand the boundaries of their role, staying within their scope of practice to avoid practicing medicine or making clinical decisions. This necessitates strong oversight and supervision by physicians or clinicians or providers to maintain the accuracy and legality of all documents or documentation. Scribes are also essential contributors to strategies like risk management, which includes training, protocol development, and regular audits as safeguards against compliance violations. Objectives here grasp the importance of legal compliance in medical scribing, understand the main legal aspects such as documentation accuracy HIPAA, compliance, informed consent, and scope of practice, learn practical strategies to uphold legal standards, including risk management and supervision, recognize the implications of non-compliance and how to prevent legal liabilities, apply this knowledge to support ethical and compliant medical documentation practices. Key points. Key legal aspects of medical scribing, understanding that adhering to legal standards are essential for medical scribes to ensure ethical and compliant documentation. These considerations not only safeguard the privacy and safety of patients, but also protect healthcare providers from legal risks. Documentation accuracy. The accuracy of documentation is paramount in creating reliable medical records that clinicians depend on to make effective decisions. Errors or omissions can lead to serious repercussions, both medically and legally. The focus here ensures that patient records reflect interactions precisely, preventing misdiagnoses or improper treatments, avoids the creation of discrepancies that could be used against providers in legal disputes. Example, failure to document a patient's allergy to penicillin could result in the prescription of a dangerous medication. Requirement here, scribes must meticulously record all physician notes, test results, and treatment plans as dictated during the encounter. Real-world scenario, a scribe accurately documenting the dosage of a prescribed medication avoids errors in patient care during follow-ups. After documentation accuracy, we have HIPAA compliance, the Health Insurance Portability and Accountability Act, HIPAA. And this is just for example that applies to USA, as there is other than HIPAA that is similar to the idea of HIPAA of protecting personal data, more particularly personal health data, and any other personal data or information that applies worldwide according to the geographical area country or state. Now, here HIPAA, the Health Insurance Portability and Accountability Act, HIPAA sets nationwide standards for the confidentiality, integrity, and security of medical information. Scribes must be fluent in HIPAA guidelines to avoid breaches of patient data privacy. Focus here protects sensitive patient health information from unauthorized access or disclosure, maintains trust between patients and healthcare providers. Example, accidentally discussing a patient's condition within earshot of unauthorized personnel could constitute a HIPAA violation. Requirement here, avoid accessing patient records without explicit need and always ensure proper safeguarding of physical and digital files. Real-world scenario, adhering to HIPAA ensures scribes do not access patient records outside their assigned scope or share records without authorization. After HIPAA compliance, we have informed consent. Patients have the right to know the role of a medical scribe in their care and must provide informed consent for their participation, as required by state regulations or organizational policy. Focus here would be ensures patients are aware of how their interactions will be documented and by whom, allows patients to make an informed decision regarding their care. Example, before a scribe is introduced to an exam room, the physician explains their role and secures patient approval. Requirement, obtain verbal or documented consent, particularly in sensitive specialties like mental health or gynecology. Real-world scenario, patient declines the presence of a scribe. The physician respects this choice, ensuring patient comfort and compliance. And here is a diagram on an understanding informed consent for medical scribes. After the informed consent, we have the scope of practice and supervision. Scope of practice, scribes are strictly prohibited from making medical decisions or performing clinical tasks that fall outside their defined role. The focus here clarifies scribes' responsibilities to avoid blurring professional boundaries. Example, a scribe records physician observations but never interprets lab results independently or makes clinical judgments. Requirement, complete only non-clinical tasks such as documentation while refraining from offering medical advice or diagnosis. Supervision and oversight. Proper supervision is necessary to maintain error-free documentation and uphold accountability. The focus here ensures that the accuracy of a scribe's entries is validated by a supervising physician. Example, a physician regularly reviews scribe-generated notes to confirm they align with the patient encounter. Requirement, follow provider instructions closely and engage in ongoing communication to clarify ambiguities. Then we have here another key point, which is risk management strategies. Legal compliance requires proactive efforts to prevent potential liabilities or breaches. Risk management involves the implementation of structured policies, training, and oversight. Training programs providing comprehensive education equips scribes with the knowledge to handle legal and ethical challenges effectively. Example, conducting mandatory HIPAA training and refresher courses ensures scribes remain updated on best practices. Documentation protocols, clear guidelines offer structure for scribing tasks, reducing variability in processes. Example, establishes a protocol that defines when and how to correct errors in the EHR, electronic health record, or EMR, electronic medical record, without compromising record integrity. Regular audits, routine reviews of scribed documentation help to catch errors early and reinforce adherence to legal requirements. An example here, monthly audits of scribe notes to identify patterns of omissions or inaccuracies or discrepancies, prompting corrective action and preventing recurrence. Examples of clinical application, implementing HIPAA compliance scenario, a team of scribes undergoes extensive HIPAA training, reducing unintentional breaches of patient information. Impact, ensures safety and confidentiality, building patient-provider trust. Utilizing consent forms for scribes. Scenario, scribe in a mental health clinic uses standardized forms to obtain explicit patient approval for their involvement impact demonstrates transparency and protects patients' rights while upholding legal obligations. Summary tables. Here we have table on key legal aspects of medical scribing, table on scope of practice and supervision, table on risk management strategies, table on examples of clinical application, table on strategies for ensuring compliance, and then next we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is a key component of documentation accuracy in medical scribing? A. Allowing errors in patient records. B. Precisely transcribing medical information. C. Disclosing sensitive information freely. Or D. Avoiding the use of medical records entirely. The answer is B, as documentation accuracy involves ensuring all medical information is recorded correctly to maintain quality healthcare and avoid legal issues. Question 2. What is one specific requirement under HIPAA compliance in medical scribing? A. Allowing scribes to diagnose patients. B. Protecting patient information with confidentiality measures. C. Ignoring unauthorized data access. Or D. Sharing patient information without restrictions. Answer is B, as HIPAA ensures that patient data remains confidential and secure. Question 3. Which aspect falls under the informed consent process in medical scribing? A. Allowing scribes to alter patient records. B. Making patient consent optional. C. Ensuring patients are informed about scribe involvement. Or D. Allowing scribes to perform medical procedures. The answer is C, as patients must be aware of the scribe's role and provide consent. Question 4. Why is supervision important in medical scribing? To allow scribes to make clinical decisions. B. To improve patient satisfaction. To improve patient satisfaction by avoiding documentation. C. To ensure the accuracy of scribe notes. Or D. To bypass legal documentation standards. The answer is C, as supervision ensures that the work of scribes meets legal and clinical standards. Question 5. What is a key risk management strategy for medical scribes? A. Conducting regular audits to identify documentation errors. B. Ignoring legal standards to save time. C. Allowing scribes to diagnose medical conditions. Or D. Disregarding the scope of practice policies. The answer is A, as regular audits help identify and resolve errors, minimizing risks. And here we come to the end of this lecture. Thank you very much and goodbye.